Alright, hi everyone. Hopefully in good mood and good situation. Today I'm going to talk about the meningitis. So here is a scenario, case-based discussion. 20 years old medical student presents to the emergency department feeling generally unwell. He's wearing sunglasses and complains of a stiff neck with a pounding headache. He has vomited twice. So, and on examination, he's carrying sign positive. Observation: heart rate 121, blood pressure 101 over 77. I'm sorry. And respiration rate gonna be 20, and temperature 38. First of all, we found out that the patient has some kind of symptoms that is related to the meningitis. So stiff neck and curing sign, which is going to be positive, and that he wears sunglasses and he has some kind of photophobia, and all of these, and as well he has some kind of high temperature. All of these gonna lead us to a meningitis diagnosis. So here, which the following the most likely cause gonna be Neisseria meningitis, which is gonna be the most common cause for the meningitis for adults. Alright, so we have highlighted the things that is related to the meningitis. He is 20 years old male student, which is gonna be the most common thing, gonna be Neisseria meningitis, as well and he as well the streptococcus pneumonia, but the most common thing gonna be Neisseria. As well, he wears sunglasses and vomited because the vomiting as well related to meningitis, and he has high temperature and heart rate. Introduction. So the meningitis and inflammation of the meninges due to the infective bacterial, viral, or fungal or non-infective causes. S. pneumonia and Neisseria meningitis are the most common bacterial causes. Enteroviruses are the most common viral cause. And the epidemiology, alright, doesn't matter. Introduction: risk factors gonna be age, immunocompromised patients, non-immunized, smoking, and crowded environment. All of these could be risk factors for getting infected with the meningitis. Bacterial, the pathophysiology for the bacteria and the viruses. The bacteria are gonna be hematogenous, spread. This is the most common. Then it's gonna be spread to the brain through the blood. This is for the bacterial level. When it got to the virus or viral level, like here, enteroviruses spread via fecal oral route, which is the most common thing that is gonna be for the viruses, which is enteroviruses. Here's the etiology. Well, we have three common causes: bacterial, viral, and fungal. When it gets to the bacterial meningitis, it is rare but potentially fatal, and viral meningitis more common but self-limiting, and fungal meningitis rarely affects people, especially the immunocompromised patients. So the bacterial ones gonna be different ages. Alright, this is for the etiology. Question 2: assuming that pillow is seen in the CSF culture of a 2-month-old child, what is the likely causative organism? Of course, it's gonna be streptococcus agalactia, because this is the most common thing that will present in the neonates, which is the streptococcus agalactia. So etiology by the age, here we have from 0 to 3 months. The group P streptococcus bacteria, this is the most common, and we found out that from 6 months to 60 years, Neisseria meningitis and streptococcus pneumonia, and over 60 years going to be streptococcus pneumonia and Neisseria meningitis. So we found out that Neisseria meningitis and streptococcus pneumonia are the most common cause for the adults, but when it gets to the infants, it's going to be the group P streptococcus, which is as well going to be named as the streptococcus agalactia. Here's the etiology. Neisseria meningitis, meningococcal meningitis, colonizes the nasopharynx and asymptomatic carriers. Um, Especially the carrier is going to be asymptomatic. Droplet spread of respiratory secretions. So this is the mode of transmission. Vaccination, this is the vaccination, which is the serotype of vaccination, which is going to be man P and man C, and as well like ACWY for the man. And mortality, right, doesn't matter, typically causes a non-planting purpuric rash. This is the most important thing about the Neisseria meningitis, which is causes kind of rash. This is what makes it unique other than other bacteria. This is for the pneumonia, pneumococcal meningitis. So droplet spread, poor outcomes compared to Neisseria meningitis. Vaccination and mortality. Well, this compared to the Neisseria meningitis. It's gonna be like better prognosis than the Neisseria meningitis. So the Neisseria meningitis will be well tolerated than the pneumonia. Okay, this is about the pneumonia. Group P streptococcus, which is Streptococcus agalactia, most common cause of neonatal meningitis, pneumonia, and sepsis. So, yeah, it's as well will cause pneumonia and sepsis. Colonizes the vagina and transmitted during birth. Currently not routinely screened for. Intrapartum antibiotics are given when diagnosis of group P streptococcus is done. The risk factor is going to be like low birth weight and prolonged membrane rupture. So these are not important, like the risk factors, but you should know that most common cause for neonatal meningitis is going to be Streptococcus agalactia, which is from the family of group P streptococcus. Streptococci, classified according to the pattern of hemolysis and blood agar, alpha, beta, and gamma hemolytic. So, in case of diagnosis on the laboratory level, the beta hemolytic gonna be for the S. pneumonia, S. agalactia, and alpha gonna be S. pneumonia. This is like for sake of diagnosis. Question 3, like the same scenario. So which of the following suggests a positive Brzezinski sign, knee and hip flexion induced by neck flexion? This is the clinical features, symptoms, meningism, which is gonna be presented by headache, photophobia, neck stiffness. But like the most important thing to me, there's gonna be neck stiffness and photophobia, because like headache gonna be present with the so many illnesses. Fever, nausea, vomiting, and seizures. Meningism is so specific for meningitis, which is gonna be photophobia and neck stiffness. Signs gonna be curing sign and Brzezinski sign, which is like I think it is well known. Curing sign is gonna be when the hip is flexed and the knee is at 90-degree. Extension of knee results in pain, and Brzezinski sign, severe neck stiffness, causes the hips and knees to flex when the neck is flexed. These are so specific signs that can be appeared on the examination of the meningitis. Also, the purpuric non-planting rash with the meningococcal disease, which is the Neisseria, pyrexia, and reduced GCS. Alright, this is about the symptoms and signs that would be appeared in a patient of meningitis. Well, like meningism and these signs. These are the most important thing. This is the clinical feature that here is, you can see, this is Brzezinski sign and this is curing sign. Here's as well. This is how it can occur: infection, then inflammatory cells and cytokines, endothelial activation, vasodilation and capillary leak, tissue ischemia and activation of coagulation cascade, prothrombotic state. So it explains how the prothrombotic state will occur. Here's differentiations. Well, here's the viral, bacterial, tuberculosis, meningitis, and encephalitis. While the viral acute onset meningism usually self-limiting, um, also can be there's some kind of CSF interpretation, but really really differs here, which is self-limiting. Unlike the bacterial meningitis here, you're gonna notice maybe fatal than the viral ones. Meningism as well. This is acute onset, and CSF interpretation, and tuberculosis meningitis can be chronic onset, prodromal malaise and fever. This is what makes it unique. CSF interpretation, PCR, and Zell-Nelson stain could be done, and chest X-ray. Encephalitis, abnormal cerebral function, meningism could be present or not, as well the CSF profile might be similar to viral meningitis. Alright, so really that I care about here is the viral gonna be self-limiting and just maybe fatal in case of the bacterial meningitis. Also, it can be chronic in level of the tuberculosis meningitis, and yeah, that is all. Same scenario again, which the following is a contraindication to lumbar puncture, hypertension, and bradycardia. So once the patient suffers from hypertension or bradycardia, there's going to be contraindication to get a lumbar puncture from. Investigations, blood glucose required to compare to CSF glucose. In the level of the blood, again, there's going to be leukocytosis, raised inflammatory markers, sepsis, and DIC. Sometimes it would be appeared there. Blood culture, PCR, and Neisseria meningitis. So all of these could be done at the level of the blood, and imaging going to be CT of the head, and for specialized test, lumbar puncture. So this is how the lumbar puncture could be done, whether in sitting or lying positions. Question 5. The patient has a serum glucose of 5.8 millimole, which the following would you expect on CSF analysis? There's gonna be like a high level of protein. CSF interpretation, in case of viral and bacterial or fungal, the fungal is the same as tuberculosis. The viral gonna be the pressure gonna be normal in the viral and elevated in case of bacterial or fungal. Appearance clear in case of the viral, cloudy, and cloudy as well in case of the fungal or TP. Sometimes you could notice fibrin or fibrin web in case of TB. WCs, lymphocytosis in case of the viral, neutrophils in case of bacterial, and lymphocytes in case of TP and fungal. Glucose elevated, it's gonna be the level of it gonna be low in the case of the viral, bacterial gonna be as well low, and fungal or TB. The serum glucose is gonna be high, more than 60% in the level of the viral, and low in the level of the fungi and bacteria. Protein less than 1 gram per liter in case of viral, and more than 1 in case of fungi and bacterial. And the reason why it is elevated in case of the bacterial and fungi because it's kind of metabolism or metabolites for the bacteria, or the antibodies that goes to the brain to fight So in case of like they are considered as proteins. This is the viral why does it low level of proteins like I don't know honestly, but it's gonna be like low in the level of the viral. Um, you commence IV fluids. Which of the following would you ideally give first? It's gonna be dexamethasone because of it's kind of steroid. It's given this is gonna be like some kind of fluid or something that you have to give once the patient has and comes to you in case and he has meningitis. The management's gonna be antibiotics, steroids like dexamethasone. I'm sorry, like I couldn't pronounce it that well. Antiviral, if in case of the viral meningitis, and IV fluids. Okay, the patient's brother has been in close contact with the patients over the last week. He's up to date with his vaccinations. What would you do? What would you advise? Well, he has to have streptococcus because this is used to be given in case of the close contact. Um, so the complications on the level of neurological, sensory neural hearing loss, seizures, cerebral edema, abscess, hydrocephalus, sometimes like at the level of the brain, and there's some kind of sepsis as well, as a complication, especially when it gets bacteria or tuberculosis. Alright, so to recap, meningitis is relatively rare but carries a high mortality. The most common cause are enteroviruses at the level of the viruses, and is pneumonia, and Neisseria meningitis is the most common bacterial cause, especially in adults, because in neonates, the most common ones is going to be the streptococcus agalactia. The definitive investigation is with CSF analysis, so it has to be done, and this is the most important investigation. Management depends on the etiology and involves antibiotics, antiviral when the cause is because of the viruses, corticosteroids as well to reduce the edema in the brain. Ciprofloxacin prophylaxis is indicated for contacts of patients with meningococcal disease. Okay, that is all. Thank you for watching.